Hi,
Hi.
Ileana.
Hi, Anne. This is our first podcast for the Ignoramus Guide to Surviving Humanity.
Yay! And our
So,
first season is going to be about the healthcare system, mainly in the United States, but also how it pertains to countries in the world.
yes, it is going to be in real time. Yes, it's going to be with the healthcare system, but because the healthcare system is connected to so many other systems in the US, like the economy, etc., we're going to sort of like be reading books that are also connected to those parts as well. Why did we choose our first book? Because basically this is a podcast around certain books to educate ourselves and make us less ignorant. So
Yes. Well, you were very excited about this book in particular.
Excited is maybe not the term I would use.
Because
But
honestly, I had never heard of it before you're like,
right.
well, we need to do this book. And we have to do this book first.
Yeah, I was kind of like thinking, well, how did the American healthcare system get to where it is? I mean, we can like, it's pretty, it's I never like to say, oh, this country is uniquely this or that, but it really feels uniquely bad, actually, like the healthcare system. So I was like, but why is it so bad? Like, there's got to be a reason. And this book is really good because it does sort of show the history of healthcare, how it started and how it changed, and really it does kind of explain. I think it makes a case for why it is the way it is.
Yes. So the book that we're talking about is called An American Sickness. It is written by Elisabeth. What is her last name?
Elisabeth Rosenthal. Rosenthal.
If we butchered the last name, I'm so sorry. But
sorry, I don't. I'm very bad at names.
But it was lovely to listen to her on NPR last week talk about things pertaining to COVID and wearing masks and messaging. And you'd think I would have remembered how they pronounced her last name then, but I do not. So Elisabeth, that's all I got. Elisabeth R.
You're just holding on to that title of ignoramus. You're just
I
holding
am. Of the two of us, I want that title.
We're just gonna, you're gonna fight me for it every step of the way.
And I'm gonna win.
We will see. No spoilers. So that's why we chose it. It's just, I think it is pretty comprehensive in the way that it lays out what's really going on.
How did you hear about this book? Do you remember?
Good question. How did I hear about? I feel like it was probably one of the many podcasts that I've listened to. You know,
Fair.
Like when I was trying to figure out. I've listened to so many podcasts and I get all these ideas for books, and then I put them somewhere and I forget where it came from. So that's not great. We'll get better at that. But I think it was just like, what's wrong with the healthcare system? Probably was what that interview was called. And I was like, what is wrong with the healthcare system? And so we're reading this book. And I think she does lay it out pretty well. Like, she sort of organizes the book in a way that's understandable.
She has a lot of examples. I almost would say too many. But I mean, there are so many more examples she could use pertaining to different situations. But it's like, I don't know about you, it stressed me out to hear example after example after example after example.
It was a stressful read. Like, I found it, not only were the examples just like, how could this happen? Like, she just gave so many examples of how it's just really inefficiency, incompetency, and really how doesn't seem to be any consequences for the continual bad care just all around. It seems to be built into the system. That's what she sort of like suggests with all her many examples. Like, as long as they make money, it actually does not matter what the outcomes are.
Mm-hmm.
That seems to be the way that this system is set up, because it's like she makes a case for it being completely set up in a capitalistic way, where like every innovation is about how do you make more money in every single area of the healthcare. So it's like the billing department, but also, you know, the doctor visits, the office visits, the lab techs, and now like the ambulances, etc. It's like goes on forever, and there's like a million ways in which you can make more money in every single area. So that's why there's so many examples of things going wrong.
And there was, as we talked before hopping on this to do this podcast, and there's an example that that stuck out to you. Do you want to talk a little bit about that one?
Yeah. So I guess I should say, let's say, okay, so an example of that, yes, you're right, is where she talks about how this affects the pharmaceutical companies, like what innovations the pharmaceutical companies come up with to hold on to the patent of a drug to extend that time period because it expires, or like just changing the formula in a way that actually doesn't serve it's like the efficiency of the drug. But in one particular case, she talked about a pill that the pharmaceutical company just like put a gel cap around the pill. And because they put a gel cap, it now has changed its formula. And so that they could then charge like a huge markup because of that. But the gel cap actually made it harder for the human body to digest. So it actually made the drug worse, but now it's like so much more expensive.
And because the patent was running out on the time, so other companies could get in on it and like, you know, lowered the price and have competition on it. They just screwed everybody out of having a good product that was less expensive.
Yeah, and she has like so many examples of how they sort of get rid of the competition. So even like free market, whatever idea, it's like this is how they get rid of like the generic drug. Like there are certain like the over-the-counter drug versus a prescription drug. You can't have both those things at the same time. So that's how they can get rid of a lot of their competition. By making it a prescription drug, you immediately get rid of it as a over-the-counter drug. So that's just one of the many, many ways that they get rid of their competition so that they can control the price.
And she also talks about how you're trying to like look up the different prices of the available medication that you have to treat whatever illness that you have. And it's like nobody shares their prices. And there's not that system in place. So it's like where you're trying to look for a medication that's maybe comparable in price, like nobody has that list because they don't share that information, because then, you know, the consumer would be able to get the lower costing drug and not have to spend $2,000 a month.
Yeah, that's an interesting thing though, because don't you have like, just as your own experience, like whenever I go to the pharmacy and I have my prescription, I'm always like, is there a generic version?
I've never asked that.
Ask that. Oh, really? You should totally ask that.
Well, I also
check for me.
I hate the healthcare system so much that I'm one of those people that I won't go to the doctor unless I absolutely have to. I also won't. I will do, like, I always will ask my doctor, is there like a homeopathic way that I can go about this? Because I don't want to take drugs. I don't want to be dependent on that. And I don't want, because it's always like, I never feel like you're treating the cause, like it's just treating the symptom and it's just worsening your body. Like if there's a natural way, that's what I want to do. So I'll take supplements, and even that, it's like you'll have a supplement that one won't really be as potent, and it's just like a bunch of filler. It's like dog food.
Yes. It's so difficult because you have to do so much research around that. And she actually does have an example about that with melatonin, which would be a supplement over the counter. I guess, would that be a herb? But, you know, some sort of non-pharmaceutical drug, really alternative to sleeping pills. And she's like, there's so much evidence to suggest that it is as effective, but it's not being researched as much because there's no money to be made there. Right. And also it's just not marketed as much. So really, like, we already have like solutions, you know, that are cheaper, but they're never going to be the ones that are presented to you.
Yeah. I mean, though I will say, because I had trouble sleeping, and like, and we'll fill you in more of this, listener, maybe there's only one, I don't know. But I just recently had surgery and I could not sleep. And so my surgeon was like, oh, we'll just do melatonin, which never has worked for me, quite frankly. Yeah. And then I went to my primary care physician who said the same thing. And then my cardiologist was like, his solution was, oh, well, then at sunset, take the melatonin.
Did it work?
No.
I mean, no. And surely, like, again, doesn't it depend, like we're saying, on the actual,
I've tried so many different brands. Yeah, I've tried so many different
honestly, brands. I've tried it as well, and it doesn't make any difference to me.
No, I'm like.
So that's where you're like, this book really falls down because she's this one example.
I went the marijuana route and the edible route, and that's the only thing that worked for me, which I don't believe
probably
that.
Still better than Ambien. I don't know.
Oh, totally. And I don't believe that she talks about. I can't remember if she talks about.
I don't remember if she talks about edibles.
Yeah, or marijuana. Or
she probably didn't want to get into a whole nother.
It is.
It seems like a whole nother book, really.
That's fair.
But so, was there anything that surprised you, like as a ignoramus, fellow ignoramus? Did you come away with this, like, oh, you know what? I didn't know this.
I mean, because I know that everything is financially motivated within that industry. And so at the end of the book, she gives all of these suggestions. And I think it was actually really helpful, somewhat really helpful. This is going to be a tangent. Sorry, I'm not going to quite answer your question. But she gives us resources like, hey, you can go onto this website and you can research like different codes and different procedures. So you can try to like price match and then like different hospitals. And then she has these things when you're contesting, which like I grew up in a conservative, like Midwestern type family where you didn't really contest anything. So it was like, oh, well, that's the bill. We'll just take it, you know?
It's embarrassing, actually. It would be like losing face. Bringing shame onto you.
Totally. And it's like, and I feel like that's, you know, like middle class.
I think that would be most people too. Just like really. Also, the other thing is you feel like this sense of that doctors or medical staff have some sort of authority, right? If they say you need something.
Yeah. Well, you think they're saving your life, you know? And I think like it's changing a little bit in society. And of course, like different cultures, what they've gone through, they're going to ask about things, and rightly so. It's like, do I need that?
Like, or even, what is this? Or maybe even less, like someone who might not be able to speak English that well it's going to be even harder to ask these questions, because I think like, I mean, there's so much actually in this book that I think we should like talk about the solution she presents in more in depth, as well as to like, do these actually make sense?
So I have a surprise for you, Ileana.
You do?
I do, even though you kind of know that
Have
it's
you
there.
figured out the solution to all our healthcare problems?
No, we're fucked on that one. This is from my surgery, like partial. There were like 10 to 15 of these itemized things just for the day of the surgery. So I want to have everybody like see, if you can, if you're watching this on YouTube, it says like surgical and there's a code underneath it. And that, so that's listed there 3 times. And there's also.
So basically one of the things that she suggests in this book is to go through your bill item by item and contest each one, or to make sure that they're charging you correctly. And so this is just an example of like what you've shown us 2 bills.
Yeah, so
3 items.
This one has the assistant surgeon. That is the same code. And then
I mean, how are we even supposed to know what these stand for?
Exactly. And how are you going to get that pre-surgery, right? So this is another one where it's an assistant surgeon. It doesn't have the S, right? So how many assistant surgeons are there? And why are there different codes?
Does that mean there's 6 assistant surgeons?
I mean, I don't know. I have no idea. Because this one has, different codes for all of them. So I don't know if they helped on something else or not. But going back to the first bill, so under the first one, it says 33413 is the surgical. Clearhealthcosts.com is the first one. And here I've already put in the replacement for an aortic valve. Now, this says 3,406. Now, another one she also gives is Fair Health Consumer. And so again, this code.
Okay, yeah. So that's the thing, like, so what she's suggesting, and she does give like pretty good descriptions of what the differences are in all these websites. She gives like about 10 websites, and it's like each one gathers the information in different ways, you know? And so, but the problem is we're supposed to type in that code into these websites before surgery so that you can figure out where to go. Like, this is one of her basically suggestions for how to protect yourself. And it's like, it just felt, but it felt impossible because, as you can see from your medical bill, it's like you have already like 9 different codes. And it's like, before you have your surgery, there's no way to really get hold of your codes, really. I mean, I've had the experience of just asking for what a normal procedure would cost and like being told like there's no way to tell me. Yeah. So how are you going to get like a specific code and then like all the items in that code before finding the doctor? Like, there's so many steps before you get to the code. Like, you have to find the doctor in network. And then the doctor has to, I don't know. I mean, the doctor themselves, the specialist, will have some sort of connection with a facility already. So it's like, you can't really shop. You can't be like, I want this person in this hospital. Like, it all has to be connected. Like, there's a route that you're guided on. You don't get to choose. You're not like, I want these shoes from JCPenney's and I want this dress from Bergdorf. Like, you don't get to do that. Yeah, you don't get to do that. So basically, the only other option that she's kind of suggesting after you've had the surgery is then to contest each item line. So it's like, yes. And so that she does give you like here's the letter to send, but it's so aggressive to me and demanding that it's like, if I read that, I would be, as a customer service person, like put off and been like, I'm not, no,
No. Like there's so many better ways, I feel like, to get people to help you out. Like even my therapist, who used to be a lawyer out in LA, was like, you need to call your call Cedars-Sinai is where I got all of mine done. And it was like, I think I've heard that you have a charitable wing, and I just wanted to see if there's any way that I can be considered for it.
So this is before you get the surgery though?
As if before or as close to after the surgery as you can, because they have, money put aside just for these things.
So does this mean that because like then we were looking at what your insurance paid for the surgery, which was
astronomical.
Insane.
So it came up to like just shy of 900,000.
That's what the insurance supposedly paid for it. But
yes.
Then there was a discount of like, I don't know, a few tens of thousands that apparently the insurer, but then from your insurance yourself, out of pocket costs, it was like 1,000 for you.
Yeah, because of COVID and because I lost my job, I got to be put on this amazing insurance subsidized by the government. Thank you for Covered California, where I paid $200 a month and I have $1,000 deductible. So
just unheard of.
So one good thing came out of COVID, at least.
COVID.
I got to work out this system, got to be terrified in the hospital, like, will I get COVID? Who knows? With my heart just getting chopped up and put back together. But yeah, it's like, you've got to find those ways to work the system, because had I had my employer's insurance, I would have been at minimum paying like $6,000 for this.
Yeah, because your deductible would be my deductible when I had a bronze Blue Shield PPO was like $7,000.
And then it's like, I had an HMO because I was told that would be like, I switched to an HMO, and then the day before I had the surgery, was told that I couldn't have it because I hadn't gone through the proper channels, even though I already had gone through the proper channels, and they were trying to put me through again. So I had to change to a PPO and delay the surgery.
I think for anyone that's not in the US, it's just not going to make any sense because it's so convoluted. It's like, I mean, even some people in the US who have good plans and never really dealt with any huge health issues probably don't even know that it can be this convoluted if you have to change plans, if you, like you're saying, in between jobs or anything like that. Suddenly you're in this weird loophole, bureaucratic, Kafkaesque like hellhole where one person is telling you one thing, you follow their advice, and you can still come back to do it again.
And I will say it, like, I think her book is very helpful for those people who do not have insurance, because if you don't have insurance, you're not paying every month for what if healthcare is at least what I refer to it. Then if you are going in to get surgery or get something done, then you can price shop. You can go to all of these different places, because then it's like,
but
nothing's in network because you don't have healthcare.
But can you really afford it? I mean, like, if you can afford to pay, like, what was one of the websites saying, like $36,000?
Right, but you can also, like, you're in a position more to negotiate, I feel like, because I will even say an example. My sister doesn't have health insurance and she wanted to get dental work done, and they're like, well, do you have insurance or don't you? Because if you have insurance, you're not going to contest things, like, because whatever your copay is or whatever that is, like, you're covered, so they can just put whatever prices they want, and they're not necessarily going to get contested by the insurance company.
Right.
And she does cover that a little bit in the book.
Yeah. And why the prices are so high. I mean, I'm still not even that clear on how or why.
Well, I think they do as much as they can get away with. And then if people are contesting it, then they like chip off a little, but they're still making a fucking killing. Can we use those words yet?
Yes, I think
considering
the gravity of considering the gravity of our subject matter, we can use any fucking word we want.
Right.
So,
Thank you.
but wait, sorry, I digressed. Going back to your point of calling Cedars-Sinai the charitable wing of the hospital, would that then cover your deductible?
I mean, it could. I didn't do it, quite frankly. I should have. And this is when
you
I'm still in therapy.
You still
it's
could.
Been a little too far out. Where
do
I
you
don't
think so? Because I have gotten bills from UCL. I had like a routine procedure from UCL Medical, and I was like, which is like, honestly, I would never go to them again. Yeah. But I was getting bills like months later, and even I got a bill like for thousands of dollars a year later, and I had to contest that, and it was like, they were like, we don't know why you were sent that. I'm like, oh, well, thanks for stressing me out for no reason.
Yeah.
So what I'm saying is, I think the healthcare system, because it's so, like, for example, one of the things I think she makes is that points that she makes is that every single thing has like 50 million different price points, because you have so many different insurance companies, you have like so many different variables, right? So there is actually, it's such an unwieldy system that I think they're incredibly inefficient, and you could like months later call to be like, because they might not have gotten to you. I don't know. So it's possible.
One of the examples that she was saying that stuck out to me was this woman took her like 14-year-old kid, might be off on that, because she was having, I don't know, she was having something done or having some symptoms. And they told her and freaked her out and said that she needs to have a brain procedure, like open her skull up and brain surgery. And they just scared her, so much because it's her daughter's life, and it's like, so she didn't really have time. It was like, well, do I save her or do I let her die? Kind of thinking. And it's like,
she's a choice, of course.
Yeah. And then Elizabeth R. Was saying that, she had a similar thing, but she had she had resources. So she called a friend who was in healthcare and asked, like, is this a thing that I need to have done? And they're like, no. So she was able to be like, oh, have that peace of mind and not like scared out of her fucking mind, and trying to save her daughter's life. So what, like, you're having these unnecessary procedures done just because you don't have the resources and you don't know. And it's like this emotional thing where it's like, does she live or die? That's really how you're thinking about it. And it doesn't, like, cost isn't, it's like there, but that's not what's, motivating you.
Yeah, I mean, that's the thing. You're not going to be like, oh, I don't want to pay $50,000 for my daughter's life. Even if you didn't have that, you would try to make it happen.
You're like, right? I'm going to figure it out. Like, this needs to be done.
Yeah, because that's what you're thinking. And I think that's the other takeaway from this book, which is very depressing, is that like everybody has to be treated like they're criminals, like in the system, because you kind of are like, these doctors, and she does make a point to be like, a lot of people come into the healthcare profession with good intentions, but the system makes it that just makes it that the bottom line is to make money. And so as a patient, you really just have to look at them like they're used car salesmen. Mm-hmm. That's basically what she's laying out in this book. So you have to treat them that way, as in like on every level, like questioning their judgment on every single thing. Like even to the point where she was saying, she did this example of like, if you're in the hospital and then someone comes to check on you. And like, I was like, how do you do that? You tell like a nurse or something to stay away from me.
Yeah.
Because you won't know.
And it's like, what? So I was like, when I was in the hospital, I had the thing where I couldn't get out of bed or the alarm would go off. And so I had to have assistance going to the restroom, you know, if I had to pee. So what am I gonna like be like, are you only here because I did the button and I have to pee? Is it something
And
else?
I'm gonna get charged. Is this an itemized bill item?
Yeah. In the meantime, I'm like peeing myself, you know, having to go through all of this stuff.
Yeah. So, I mean, I think, so that's the kind of the problem with the cases that, or rather the solutions she comes up with, they're not really that doable. Like, I just don't think anyone can go through especially a major heart surgery like yours.
Well, and if it's an emergency thing, like you don't have the time to go through all of those steps because it's a full-time job. It's calling everybody and, you know, doing all of this research and as much as you can, price shopping. And it's just like, you know, when it's like a fear-driven thing, you can't do it.
Yeah, it's not possible. So really the only solution in this whole crazy system is actually the one that you came up with, but also that you had, which was you have to get the best insurance for the cheapest price. But like, you know, it doesn't make sense also to get the best insurance out of pocket and pay like $500 or $600 a month. So that doesn't make sense.
Yeah. And then it's like, if you're just getting this procedure done, then it's like, get that. And then once that's all taken care of, switch to the cheapest one.
You think that's?
If you're able to. So like 6 months.
Yeah, but there's also only a specific time in the year that you can switch plans.
Yes.
Which
for the United States, I don't know how. Yeah.
No, I don't think anyone else does that. That's crazy.
Yeah, because they're set up so much better.
Well,
yeah. Or if also, you like get a divorce, then you can. Or if you lose your job or switch to a new job, like there are these other things that can trigger it changing.
You have to have like major life events in order to change your insurance plan.
Yes. And you know, it's like I had somebody guiding me on like how to do this and how to work the system a little bit, because without that advocate, like I would have been paying so much more and it just would have been a mess.
Yeah. So at the end, in the conclusion to this, reading this book, like going into this being like, we're pretty ignorant about the healthcare system. How are we going to know about it and protect ourselves and find solutions? At the end of this whole book, we're like, hire someone.
Yeah.
That's
because that's it's like, I mean, geez, it's just that book stressed me out. I'm glad it exists. It sheds light on a lot of things. But it's like case after case after case after case of like horrible thing stresses me out. And then even the solutions that are in place, the solutions to get around what we currently have are just atrocious and time consuming and not applicable to every instance, you know?
Or even if it is the amount of time it would take for you to go through all her suggestions, and like we were saying, they don't even make sense. Like, for example, the whole thing about you can choose your doctor, but then you can't choose the place that you get the surgery.
Right.
So it's like you can, like in her utopian world, which is not even, she's not saying this is utopian at all, but like even in her suggestions is that you would be able to have the choices if you had the knowledge, but you don't actually have those choices even with that knowledge.
Yeah.
So that's like the depressing part of it. But it is, I think, a really good book in that it does hold these things accountable. And I will say that the other thing that it made me depressed about is that it highlighted the problem with these charitable foundations. Like that was like a little bit like, okay, so I was already a little bit suspicious of certain charitable foundations, but she's like, because I know that they have so much money, and it's like, again, if they're going to treat their NGOs like a corporation, you know, there's some ethics involved that I think are pretty nuanced and complicated. But she even makes the point that within this capitalistic system, these like the Diabetes Association, or, you know, she mentions different foundations, they are only going to do research into a drug to treat this disease that they're apparently, you know, advocating if it makes money. Like they actually look at it as venture capitalism, like what venture philanthropy is, what the term that they've coined for even charitable organizations. So now I'm like, if I see one of those like breast cancer awareness or breast cancer research or cancer research foundation, I'm immediately like thinking, well, I don't, you know.
You have to do your research on everything, yeah.
You have to do your research on everything, but also most likely a huge foundation like that will have so much money, and they're probably going to manage it in a way like she's suggesting, because it's almost like now you're looking at it like shareholders and a board and etc. And so they'll think of the research in a way of like, how do we actually make money?
Yep.
So that's
disheartening.
Yes. That's disheartening. And it's probably, and these things can probably apply to almost every area, like in the world, in terms of like, if it's just purely capitalistic.
Yeah, I mean, trace the money, like look at how they're set up, look at, it's all finances.
Yes, it's all, yes, it all comes down to economics. So
yeah.
Well, I was thinking about this, if it all comes down to finances, you know. And really, like, one of the things that she does advocate, or kind of like, she doesn't come out and say it outright, but she makes the case for Medicare for all, right? She doesn't like come out and be like, okay, I'm for it. But she does make the case in the book because it's like a system already in place.
Right. If we're going to not totally tear the structure down and rebuild, which that's not going to happen, it's like, what she does make a great case about, like, how to alter what we already have in place. And that's like lowering the age gradually to pay into Medicare.
The Medicare for all thing is something that we could explore more. And there's a book by someone. I think it's Abdul El-Sayed.
By a robot, but by a person.
I think it's Dr. Abdul El-Sayed, called Healing Politics. So that's one of the books that we want to do. But also, on the other hand, like I was thinking, because it is about finances, and like a lot of the case against Medicare for all is like, how do we afford it? And so the other book that I want to do is The Deficit Myth by Stephanie Kelton.
Things to look forward to for season 1 of the Ignoramus's Guide
to Surviving Humanity.
Thank you. You took your cues so well.
I can read.
Again, ignoramus. Winning this one.
Yay.
Okay.